Okay, hi guys, welcome back to my YouTube channel, Margaret Love Nursing. My name is Margaret and I truly love nursing. So today, 26th of June, individuals, communities, organizations all over the world are celebrating the World No Drug Abuse Day with the aim of creating a world of no drug abuse. So as a nephrology nurse with my passions for the kidney, I am happy, super happy to join the train that provides solution, practical solution to drug problems in our society. I'm going to be sharing with you today facts about what drugs can actually do to your kidney. A lot of people out there, they don't know that drugs actually have any issues to do with the kidney. Come on guys, a whole lot. It has a whole lot to do with the kidney, But before I go ahead, I would like to talk about what are these kidneys. It's a vital organ in the body and normally comes in twos. But you need only one to survive. The kidney are made up of numerous tiny, fragile filters called the glomerulus. I call the kidneys the washing machine of the body because it excretes waste products and excess water in the body. It regulates a lot of things actually. The kidney regulates the blood volume, the blood pressure, the blood pH, regulates metabolites, a lot of things are done by the kidney. So it's vital. Drug excretion in the body. There's an organ called the liver. Actually excretes some of the drugs, but the kidney does the rest. When it comes to drug excretion in the body, the kidney is in fact, the most important one. Can I please say that if you don't have to take drugs, do not. Because all drugs, I repeat, all of them are potential poisons. They are chemicals after all. Come to think about it. Chemicals, once you take them in, you have no control over it. Drugs should be the last resort. It shouldn't be the first point of call. You should have done a lot of things, and then the last thing you want to talk about is to take in those chemicals into your body, and then you have no control over it again. Even prescribed drugs that are prescribed by professionals have therapeutic window. And what do I mean by therapeutic window? It's the dosage of that you take, and it does the work you want it to do, and it's still effective with minimal side effect. Minimal, I said. Remember, all of them are potential. I've told you they are chemicals. All of them have side effect, adverse effects. So why would you take surge into your body? And especially those of you taking drugs anyhow. Wait, when we talk about drugs, do we only mean cocaine, the generally abused drugs commonly that everybody believes to be drug abuse, like cocaine, marijuana, you smoke this, you sniff that? That's not just all about drug abuse. Come to think about it. Hey sis, what about that drug that you take every month, all in the name of menstrual pain? That analgesic you take after work every day, how about that one? Who prescribed it? For how long have you been taking it now? Is it within the therapeutic window? Is it outside it? All of this leads to renal failure, one way or the other, and that takes us to what is renal failure? When it can no longer perform its function. Either it cannot perform it at all or it cannot perform it well. Then it's going into failure. That's when we talk about renal failure. Kidney failure. What kidney? Renal. Yes, it can be used interchangeably. So, and this will be discussed in 3 phases, okay? Pre-renal, intrarenal, and post-renal. Pre-renal before the kidneys. Intrarenal, the kidney itself is where the injuries, insult coming to directly, and post-renal is after the kidney. Kidney already produces urine, has done everything, is ready to, excrete the waste product, and something somewhere is causing trouble outside. Pre-renal failure occurs when you take any drug that can prevent blood flow or reduce blood flow to your kidneys, okay? When blood don't get to an area of the body, trust me, nutrients, oxygen, whatever that is vital for survival, does not get there too, okay? So the cells of the kidney begin to die off, and then failure. Intrarenal failure, how that happens with drugs is, I'll explain this with some illustration. When you give the drug, every time you give the drug, you remember I told you there are chemicals, they kill off this renal cell. They add insults, okay, to the kidney. Kidney can be rugged though. When you take the drug, the cell dies. As you ingest the drug, the cell in the kidneys, they die off. Okay, when you stop it immediately, those cells recover. Is that simple? Okay, take the drug, the cell dies, stop the drug, they recover. One, you can take the drug, the cell die, you don't stop it, they start sloughing off, those cells, those dead cells begin to remove. And and as they slough off, they block the tubules, those urine, the filters that urine is supposed to pass, they start blocking it. And then, but if at this stage you stop the drug, that one is a bad one. Trust me, you don't want to deal with it, because when you take that drug, like I said, it causes cell death, the cells are sloughing, it causes tubular obstruction, further kidney injury. You still have not stopped, you continue. So waste product is going to build up in the body and it's going to cause more trouble until it leads to end stage renal disease. Did you say end stage? Yes, end stage. So post-renal, the kidney already did its job, formed the urine, waste product already extracted out of the body, but it's on its way out. Something is blocking the way. Oh gosh, something is blocking the way, and that's going to cause problem. That's post-renal. But for post-renal, if the offender is removed as soon as possible, it's often reversible. But if it's delayed, delay is dangerous, guys. If it's delayed, it can lead to acute renal failure, injury, or chronic kidney disease. Especially in the enlightened world, ask me what is commonly abused. Yeah, people are educated, you're not supposed to take cannabis, you're not supposed to take heroin, you're not supposed to smoke, you're not supposed to drink this, you're not supposed to do that. But look at this very strong analgesic. They call it NSAIDs, non-steroidal anti-inflammatory drugs. People use them for menstrual pain, for body aches, prevention. The most heartbreaking one for me is for SCD patients, sickle cell disease patients. They're going through a lot already. But if you keep taking that analgesic in the way you think you're doing, if you don't stop, guy, kidney failure, trust me, you don't want to deal with it. Please stop, okay? So if you must take all this medication, because earlier I mentioned antifungal drug, anti-cancer drugs, antibiotics. See, when you talk about antibiotics, they are usually given in large dose because they want them to combat it, especially in severe infection. Antibiotics that are given are the renally excreted antibiotics, and usually in severe infection. Okay, so what we do is that they are given in large doses that is sufficient enough to combat the disease. Yeah, it will bash the kidney, but they give them in large daily doses so that if they are given now, like 10 a.m. today, you don't have to give it until after 24 hours. The kidney would have excreted the drug out and have chance of recovering before you bash it again and give the next dose, okay? So please, if you don't have to take all these drugs, don't take them. And for those that, because of one condition or the other, the antihypertensive, anti-diabetic drug, antifungal, antibiotics, all of this, the radiological dye for investigation. Please, when you're prescribing, prescribers out there, it's a teamwork after all. Can you please work with your pharmacist to be sure of the therapeutic dose for that specific patient, for that specific client? And as for those of you, my guys, with a big can without prescription, hey, I don't know what to say, but all I can say is that you please stop the use of nephrotoxic drugs. In a summary, I would say only take nephrotoxic drugs when the benefit outweighs the evil that is in there. If you know that you have to take it, you weigh your options. For those of you that need to take one drug or the other, can you please work with your caregivers? Get back to your prescriber. Don't do anything on your own. For us, the health caregivers that are always prescribing these drugs, please be sure, okay? And it's always a teamwork. I would emphasize, work with the pharmacist. And for specific patients, not the same doses for everyone. So please drink water. Water flushes all these things out of our system. Drink a lot of water. In 24 hours, you can drink up to 4 to 5 liters. I know it's not easy to start, but then just start and somehow you find your way onto it. For those of you who cannot stop this on your own because of dependence, I understand. Can you please seek help? Speak up. And for the general populace, can you stop stigmatizing people? You are not helping them. Stop judging. Something leads to something. That's why they are in it. They need after all, and we need to put up the attitude to really help them so that they don't do it again. Together we can try to figure out a way to help people independence instead of stigmatizing. So guys, please don't forget to like, share, comment, and subscribe to my YouTube channel, Margaret Loves Nursing. I love you so much. Bye.